Chapter 7, Chronic Disease Management. Overview of chronic disease. So chronic diseases are long-term, non-contagious, and irreversible conditions. These can be related to unhealthy behaviors, or it can be something that was genetic. So chronic disease in the U.S. accounts for about 70% of deaths, and it costs about $4.1 trillion a year. So chronic disease is important to manage, and those include regular appointments, medications, and treatment. Individual management. When it comes to chronic disease, it's important for the individual to manage their health issues. So they have to adhere to strict medical treatment regimens, significant dietary modifications, increased physical activity, and other behavioral changes that might be specific to their certain disease that they are dealing with. It's important for a patient to have knowledge about their disease and to have some self-efficacy and self-control when it comes to the individual management of their disease in between their doctor's appointments. Historical context of disease patterns. So back in the day, basically people died from infectious diseases, and that was due to improper sanitation, poor hygiene, and lack of defense against communicable diseases. And in the early 1900s, life expectancy was 49.2 years, but as of 2020, life expectancy is 77.28 years. And that's because there have been a variety of ways to deal with these things. So having proper sanitation, proper hygiene, proper defense against communicable diseases such as vaccines and penicillin. And now people are more so dealing with chronic disease. Back in the day, people used to also deal with labor, service-based labor, and they had to utilize their whole entire bodies. But now a lot of people work from home, or they'll sit at a desk, and being sedentary could lead to a decrease in chronic diseases. Alzheimer's disease is the most common form of dementia. It's related to symptoms of memory loss, decline in cognitive functioning, difficulty remembering information that has been recently learned. Also, there may be confusion, behavioral changes, and impaired judgment. And right now, it is the 7th leading cause of disease. Asthma. So it's dealing with shortness of breath, chest tightness, and wheezing, and it affects about 20.4 million adults and about 6 million children in the U.S. annually. So people have difficulty with breathing, and there's many things that could trigger this, and that would be tobacco smoke, air pollution, dander, pollen, and it's also the most common childhood chronic illness, and it costs about $56 billion a year. Cancer. This is described as the presence of abnormal cell growth leading to malignant tumors, and there are more than 100 different types of cancers. The most commonly diagnosed ones are prostate cancer. So for men, that's 27.3% of new cases. Lung is 12%, and the colon is 8.5%. Now, for women, the most common cases are breast cancer at 30.8%, lung cancer at 12.7%, and colon cancer at 8.2%. So the risk factors could be age and genetic predisposition, and it accounts for a third of all cancer deaths are due to the effects of things that could be changed, such as tobacco smoking and physical inactivity, poor diet, poor choices. It is currently the 2nd leading cause of death in the U.S. Cardiovascular diseases are the number one cause of death in the U.S., and that's dealing with artery clogging plaque. So mainly in the heart and the brain, reduction of oxygen flow, heart attacks, strokes. Some risk factors for cardiovascular disease could include pre-existing conditions such as diabetes, obesity, hypertension, and high cholesterol. There are also behavioral and lifestyle factors such as physical inactivity, the type of diet a person has, a poor diet, cigarette smoking, and excessive consumption of alcohol. Chronic obstructive pulmonary disease, and that's known as COPD. So basically the air that goes into the lungs is obstructed, leading to breathing issues. And this could be due to the effects of smoking, environmental triggers such as pollen, air pollution, smog, and people deal with wheezing, cough, and fatigue. COPD is currently the 6th leading cause of death in the U.S. Diabetes mellitus. So we're going to talk about type 1 and type 2. This develops when the body is unable to properly use or produce insulin. About 37.3 million people have diabetes, so that's 11.3% of the population. About 90 to 95% of people with diabetes have type 2, and there are estimates of 8.5% of people in the US that have yet to be diagnosed. So type 1 is due to genetic predisposition, and sometimes it's called childhood diabetes, and type 2 is the result of unhealthy behavior such as obesity, physical inactivity, and poor eating habits. So if this is not properly treated, it can lead to vision problems, kidney damage, foot problems, nerve damage, poor circulation, and lead to amputations. Hypertension, also known as high blood pressure, affects 47% of people in the United States, and the blood pressure that accounts for hypertension would be 130/80. Some risks for this would be behavioral factors such as smoking, poor diet, lack of exercise. However, it could also be genetics and age. So if this is not properly treated, it could lead to stroke and heart disease. And sometimes hypertension is known as a silent disease since people may not realize that they are at risk. Chronic disease risk factors. So these could be related to behavioral changes. You have to think about how someone's eating, if they're smoking or drinking to excess. But we also have to look at other factors, which would be causal factors. And that would be modifiable risk factors such as changing their behaviors or thinking about the local environment. And then there are other factors that cannot be changed, and that would be genetic predisposition and aging. Social determinants of health have 3 areas of influence: social institutions, surrounding, and social relationships. So we have to think about where people are around. Is it a low income area where they have food deserts, where people don't have access to quality healthy foods or quality supermarkets? Do people have increased exposure to fast food restaurants, liquor stores, and convenience stores? And they don't have healthy foods in those environments. Do people live in areas with higher rates of crime and less access to safe places such as parks or recreational areas? Because of course people aren't going to be outside as much if they live in a high crime area. So chronic disease does go hand in hand with these issues. It is important to address the social determinants that affect these issues. Genetics. Certain genetic predispositions can play a role in the development of certain chronic conditions, such as with cancer, and those that develop breast cancer with the gene 1 and gene 2. So BRCA1 and BRCA2. But there are tests for those that people can seek out through their healthcare professional, especially if they have breast cancer in their family. people are more likely to developing breast cancer if they have those genes. And also certain populations can be looked at if they typically have a certain disease or a certain chronic illness, and if those people could be checked who fit the profile, checked just to make sure they don't have those certain disease or illnesses present. Chronic disease management. So this is where the healthcare providers collaborate to ensure that the patient is getting the best care possible. They're focused on increasing the quality of life and the functionality of the patient, as well as making sure that there is a decrease in mortality for people dealing with chronic disease. So the team has to work together. That's health providers, caregivers, and patients, just to make sure that the patient has the best quality of life. Quality of life can be measured in different ways. For some people, it could deal with income, socioeconomic status, and environmental quality, or even educational attainment. But healthcare practitioners may look at it as health and well-being and the health-related quality of life. So they're thinking about a person's mental faculties and the person's physical faculties over time. Is the patient able to function with their illness? How much of their life are they able to participate in? How many limitations do they have placed on themselves? Is the person able to accomplish their activities of daily living? Or are they able to just do basic activities of daily living as far as self-care responsibilities? Do they need help with those things? Are they able to take care of their own finances? Are they able to cook for themselves, shop, use devices? How much help do they need from healthcare professionals or from their health caregivers? Chronic disease management at the individual level. When patients have chronic disease, it is very important for them to have self-efficacy when it comes to managing the burden of their disease, because when you think about it, the patient has to maintain their health in between doctor's appointments. So they have to take care of the treatment, management of their symptoms, management of their routine, and management if their disease or their symptomology is worsening over time. They have to know when to reach out to get help, and they have to be educated and advocate for themselves. Comorbid conditions. Some patients have to deal with one morbidity while others have to deal with multiple. So a patient might have multiple illnesses that they have to balance. And that means that they have to rely on more self-management for these diseases in between the time that they're able to see their physicians. What can be affected by this is adherence to medications, because treatment for one disease might cause an issue for another disease. And when it comes to adherence for medications, we're talking about the degree to which what is prescribed to a patient that the patient actually takes, especially if there are side effects. Also, when a patient has more than one illness or chronic disease, it may leave the patient feeling overwhelmed and unsure of how to balance their illnesses. They also need to have the education and the wherewithal to know when to ask for help. Barriers to individual level chronic disease management programs. So with any program, there will be barriers. So on the individual level, it could be if a person does not understand the information that they're taking in regarding their chronic illness, and that could be health literacy. So when you think of health literacy, just know that it refers to an individual's ability to find, process, and understand information and services that are relevant to their health condition and the treatment of their health condition. So an individual needs to understand how to read their prescription labels, how to read and understand appointment slips, health brochures, and then also they need to understand and feel comfortable with communicating with their provider and also their instructions. So this just often depends on the individual's level of comfort. It's very important for there to be cultural competency when it comes to dealing with patients, and then also taking into account their age if they are poor, so the differences in income between the provider and the patient, and then also their immigrant status or people who don't speak English. Furthermore, there are a large number of people in the U.S. that do not read above a seventh grade level. So if you think about that, that's between the ages of 12 and 14. So usually when it comes to healthcare, it's good to have pamphlets or brochures or diagrams and pictures, be at a fourth grade or between a sixth grade reading level, just to make sure more people are able to understand, especially with the growing population of baby boomers, since they are the largest population of elderly people the U.S. has ever dealt with. Chronic disease management at the interpersonal level. A powerful tool in helping people with chronic disease management is support from people that love them and that they love, such as family, friends, and social networks. And this could help improve their physical and emotional well-being, and that has been demonstrated through research. So caregivers can be family members, any other individual who assists, friends, church members, friends of friends, just people that are part of the community that cares about this adult and their chronic disease. So it's estimated about 29% of U.S. adults are caregivers in some form, and those numbers still remain about true today, and it's about 53 million adults that are caregivers. Social support techniques for children. About an estimation of 7 to 15% of children under the age of 18 are diagnosed with a chronic condition every year in the United States, most of that being asthma. And then there's also diabetes that comes up after that. So it's important for the children to practice self-care and monitoring on a routine basis. However, of course, in order to have that be optimal, they need support from their parents and other caregivers. And that's also often the most common form of support would be emotional and helping them take care of their illness, whether it be giving themselves an injection or helping them understand the diet that they should be on or with physical activities. So currently there's about 6 million children in the U.S. that have asthma, and so they need support at the interpersonal level. Barriers to interpersonal chronic disease programs. So among these barriers would be that the caregivers must actually be open to learning and also to teaching the children in order to help them. Also, the caregivers can't be burnt out. If they don't provide care for themselves, then they'll be unable to care for the person with the chronic condition, whether it's an adult or a child. So people have to be open to receiving educational messages and feedback that's supportive, or it could hinder the process. People also need to have time, transportation in order to get to the facilities that will enhance their health. And it's just very important to have support from parental figures. So with adolescents, sometimes they do not want to hear that type of information from parental figures, but it just depends on their relationship and maybe if the adolescent is experiencing teen angst or some other challenges. But if there's other people that they look up to in the family or friends or people that are close in the community, that would be beneficial also. And then also sometimes parents can be overbearing if their child has a health issue. So it's very important that those caregivers allow that child to grow and still become independent as independent as they can while dealing with a certain illness. Other barriers would be how much time people have to work, which means that they have less time to be a caregiver. And they also might be a caregiver while also taking care of their own children. So they might be part of that sandwich generation. Chronic disease management at the organizational level. So usually that brings schools and job sites into play. And it's been shown to be successful when it comes to chronic disease prevention as far as having physical activity in schools and anti-smoking policies. But it's important to utilize the healthcare system dealing with chronic care. So that's why there's the chronic care model. and just to have that primary care settings. And it's just important to have a collaboration between various health specialists. So that can be called interdisciplinary or multidisciplinary, but it's just important to make sure that the patients have the best care, and that's having multiple health specialists work together in order to make sure that individual has the best care for their morbidity or their comorbidities. That also means pooling money, resources, and time all together just to make sure the person has what they need. And um, just depending on budgets and things like that, everything might not be delegated proportionally the way it should be, but the chronic care model, which is CCM, um, just basically has been a benefit for people at the organizational level. The chronic care model is just a collaboration of many different health providers, and it has positive health outcomes for the patient because they become educated and informed. They gain self-efficacy and confidence in caring for themselves and discussing their health goals with their health providers. Additionally, they learn about resources that are available to them. Intervention focused at the organizational level, so there was impact, improving mood, promoting access to collaborative care treatment, and that was a trial that had a collaborative team approach, and it was to hopefully have goals to decrease depression, but basically having multiple physicians work together to make sure the entirety of the patient is focused on, not just that one health issue that they might be dealing with. And when those programs happen, the doctors work together, the patients have demonstrated that they are happier over time, that their health is more taken care of, that they're adhering to um, the doctor's orders and the medication, their quality of life and their mental functioning is also improved compared to those that have not been part of the program. So if you want to look at spotlights and more information about this, that's on page 214 and 215 of your book. It'll be the boxes in green. Barriers to organizational level for chronic disease management programs would be a lack of cultural competence. So it's important to understand that depending on people's culture, they might have certain procedures or rituals or spirituality that applies to them. It's important to have at least some basic understanding and allow that patient to know that you have a basic understanding so that way they can feel more trust. A person doesn't necessarily have to be of the same culture in order to provide cultural competence, but it also is helpful if the person is. But having respect for the person's culture also gives patients some groundwork and appreciation and rapport in order to know that the healthcare care worker or doctors respect them and helps with the trust. And some schools, some medical schools, different hospitals are implementing programs to make sure people have a semester or a year of cultural competence. Chronic disease management at the community level. So a community is a group of people with common values, beliefs, and they have a sense of belonging to a certain group or groups. Um, so interventions need to focus on a specific population of people or people that are in a specific area, which would still be a specific population. And it's just very important to get information also from the people that are part of that population since they know what their issues are usually. So sometimes some um, health workers will work with community lay people or community health workers that have already gained trust of the community. Um, and that helps bridge the gap between healthcare professionals and the people in the community. Also, it helps build trust, especially if they speak the same language or have similar cultural values or backgrounds. Um, so, when it comes to the U.S. Mexico border, there are interventionists that use promotoros or health promoters to deal with the health of people that live on the border because they understand um, Mexican culture, they understand health, they understand what they need as far as health in the U.S., so they can act like a liaison in between. And they could also train people in the community to continue with that management for chronic disease. They can bring resources to them, or they have access to more resources, get the community engaged and motivated for sustainability. They can help with translation. They can help patients navigate the healthcare system. They can help them sign up for insurance, or maybe doctor's offices that pay on a sliding scale. And then also helping them keep medical appointments and understanding the culture of medical appointments in the U.S. versus maybe a culture that they have come from. It also helps with medication adherence and adherence with following doctor's orders, and additionally helps with communicating with providers. So barriers to chronic disease management at the community level could be with resources or lack thereof of resources. So when it comes to budgets and grants, maybe if the program or center didn't receive as much money as they should have or hope to, then sometimes certain programs are cut, or certain resources that they normally would want to have available are cut. So this depends on budgetary concerns, and deals with withdrawal of assistance. So some withdrawal or complete withdrawal. Chronic disease management at the policy level. So many strategies are aimed at prevention of a disease, and managing that disease over time. So we could think of additional taxes on cigarettes. Some places have had additional taxes on sugary foods or snacks. Also taking snacks out of schools. Certain access to snacks out of schools, maybe during lunch, also not have those foods available, or even taking away soda machines or different types of sodas, or having less. Also making sure that food chains have to disclose nutritional information so people can know what's in the foods and to understand their caloric intake. Recent chronic disease management policy advances. So in 2001, the Institute of Medicine had a report that outlined the state of healthcare in the U.S., and it had 6 aims. And that is to be safe, so avoiding harm, effective, making sure that services are based on scientific knowledge and are beneficial, make sure they are patient-centered, so make sure it goes with patients' preferences, needs, values, and their time, and also their ability. 4 would be timely, so reducing the amount of wait times and delays that people have to deal with. Additionally, there is efficiency, so avoiding wasting equipment or resources that people could use. And number 6, being equitable, so providing equal care, equitable care, and quality care, no matter who the patient is. And so medical schools are, as I mentioned before, having a semester or sometimes 2 semesters of classes dealing with patient-centered care and communication styles with patients. Transforming primary care. So primary care is leaving away from acute illness and more so dealing with maintaining chronic illness. So that means the entire U.S. system needs to change in order to deal with the amount of people that are dealing with morbidities or comorbidities. And it's very important just to make sure that the system reflects that. So some parts of the healthcare system basically values volume over quality. So they want physicians to see more patients versus spending more time with patients. So we need basically the primary care setting and the incentives from the healthcare model to focus on helping people do better with their comorbidities or morbidity, and making sure the patients are satisfied, having quality care, having improvements in their health, and have that help with patient reimbursement. Also, that it should be taken into account that there's going to need to be more interdisciplinary models, and physicians that are part of those models should all be reimbursed. Even if they're not heading the case, they're still part of that case to help that patient maintain their overall health. So the Affordable Care Act helped with some ways of rewarding medical providers who work with collaborative care just to make sure patients are healthy. And also works with patient-centered care for those who are chronically ill. Barriers to chronic disease management at a policy level is that there hasn't been enough of a shift to deal with chronic disease. Sometimes we still focus on acute treatment, so patients only have time to deal with one health issue when they go to a doctor instead of time to deal with their entire self. So it's also difficult to secure funding for certain programs, but that gap needs to be narrowed because more people have more illnesses and people are also living longer. Additionally, we have to think about financial, economic, and political reasons when it comes to policies, agenda setting, and making substantial changes. Additionally, access to healthcare is another barrier. We have to think about how people are able to get to the doctor, if they have access to going to the doctor, if they have access to being insured. So the Affordable Care Act did help decrease the amount of people who were uninsured in the U.S. But currently, well, as of 2022, 9.2% of the U.S. is still uninsured, and that is 27.5 million people in the U.S. But having high insurance or being underinsured or not insured, those are all negatives. And having a law passed that gives everybody access to medical care, access to health care, would be beneficial for the entirety of the United States. But before that, it would be 60% of the U.S. that was uninsured, or 70%, sometimes 50%. So the laws have helped that have been passed, but there needs to be more that is done.